Question 1. A nurse in the emergency department receives a prescription to administer dopamine at 8 micrograms per kilogram per minute to a client weighing 176 pounds. The pharmacy supplies dopamine 400 milligrams in 250 milliliters D5W. The nurse must determine the correct infusion rate in ml/HR using dimensional analysis. What infusion rate should the nurse program into the infusion pump? A. 9.6 milliliters per hour. B. 12 milliliters per hour. C. 24 milliliters per hour. D. 48 milliliters per hour. Answer. C. 24 milliliters per hour. Rationale. 176 Pfund Divisionszeichen 2.2 gleich 80 Kilogramm. 8 mcg Multiplikationszeichen 80 Kilogramm gleich 640 mcg Minuten. 640 micrograms per minute times 60 is equal to 38,400 mcg/HR equals 38.4 milligrams per hour. 400 milligrams divided by 250 milliliters equals 1.6 milligrams per milliliter. 38.4 milligrams per hour divided by 1.6 milligrams per milliliter equals 24 milliliters per hour. Question 2. A critically ill client is prescribed heparin at 18 units/kg/HR. The client weighs 92 kilograms. The 4-bag contains heparin 25,000 units in 500 milliliters normal saline. Using dimensional analysis, what is the correct infusion rate? A. 16.6 milliliters per hour. B. 24.8 milliliters per hour. C. 33.1 milliliters per hour. D. 41.4 milliliters per hour. Answer. C. 33.1 milliliters per hour. Rationale. 18 units times 92 kilograms equals 1,656 units/HR. 25,000 units divided by 500 milliliters equals 50 units/ml. 1,656 units/HR divided by 50 units/ml equals 33.12 milliliters per hour. Rounded equals 33.1 milliliters per hour. Question 3. A provider prescribes nitroglycerin at 15 micrograms per minute for a client experiencing chest pain. The pharmacy sends nitroglycerin 50 milligrams in 250 milliliters D5W. What infusion rate should the nurse set using dimensional analysis? A. 2.5 milliliters per hour. B. 4.5 milliliters per hour. C. 6.0 milliliters per hour. D. 9.5 milliliters per hour. Answer. B. 4.5 milliliters per hour. Rationale. 15 micrograms per minute times 60 is equal to 900 mcg/HR equals 0.9 milligrams per hour. 50 milligrams divided by 250 milliliters equals 0.2 milligrams per milliliter. 0.9 milligrams per hour divided by 0.2 milligrams per milliliter equals 4.5 milliliters per hour. Question 4. A post-operative client weighing 154 pounds is prescribed morphine 0.08 milligrams per kilogram for every 4 hours PRN severe pain. The vial contains morphine 10 milligrams per milliliter. How many milliliters should the nurse administer? A. 0.28 milliliters. B. 0.42 milliliters. C. 0.56 milliliters. D. 0.84 milliliters. Answer. C. 0.56 milliliters. Rationale. 154 Pfund Divisionszeichen 2.2 gleich 70 Kilogramm. 0.08 milligrams times 70 kilograms equals 5.6 milligrams. 5.6 milligrams divided by 10 milligrams per milliliter equals 0.56 milliliters. Question 5. A child weighing 33 pounds is prescribed ceftriaxone 75 milligrams per kilogram per day, 4 divided into 2 equal doses. How many milligrams should the nurse administer per dose? A. 375 milligrams. B. 450 milligrams. C. 562.5 milligrams. D. 750 milligrams. Answer. C. 562.5 milligrams. Rationale. 33 Pfund Divisionszeichen 2.2 gleich 15 Kilogramm. 75 milligrams times 15 kilograms equals 1,125 milligrams per day. 1,125 milligrams divided by 2 doses equals 562.5 milligrams per dose. Question 6. A client with atrial fibrillation is prescribed diltiazem at 10 milligrams per hour by continuous infusion. The pharmacy supplies diltiazem 125 milligrams in 100 milliliters. What rate should the nurse set on the infusion pump? A. 6 milliliters per hour. B. 8 milliliters per hour. C. 10 milliliters per hour. D. 12.5 milliliters per hour. Answer. B. 8 milliliters per hour. Rationale. 125 milligrams divided by 100 milliliters equals 1.25 milligrams per milliliter. 10 milligrams per hour divided by 1.25 milligrams per milliliter equals 8 milliliters per hour. Question 7. A nurse must administer phenytoin 15 milligrams per kilogram for a loading dose to a client weighing 84 kilograms. The available concentration is 50 milligrams per milliliter. How many milliliters should the nurse prepare? A. 18.2 milliliters. B. 21.4 milliliters. C. 25.2 milliliters. D. 30.8 milliliters. Answer. C. 25.2 milliliters. Rationale. 15 milligrams times 84 kilograms equals 1,260 milligrams. 1,260 milligrams divided by 50 milligrams per milliliter equals 25.2 milliliters. Question 8. A provider prescribes regular insulin infusion at 0.1 unit/kg/HR for a client with diabetic ketoacidosis weighing 198 pounds. The 4 solution contains 100 units insulin in 100 milliliters NS. What infusion rate should the nurse administer? A. 4.5 milliliters per hour. B. 7.2 milliliters per hour. C. 9 milliliters per hour. D. 12 milliliters per hour. Answer. C. 9 milliliters per hour. Rationale. 198 Pfund Divisionszeichen 2.2 gleich 90 Kilogramm. 0.1 unit times 90 kilograms equals 9 units/HR. 100 units divided by 100 milliliters equals 1 unit/ml. 9 units/HR equals 9 milliliters per hour. Question 9. A nurse is preparing vancomycin 1.5 g IV/PB to infuse over 90 minutes. The 4-bag contains 1.5 g in 300 milliliters. What rate should the nurse program into the infusion pump? A. 100 milliliters per hour. B. 150 milliliters per hour. C. 200 milliliters per hour. D. 250 milliliters per hour. Answer. C. 200 milliliters per hour. Rationale. 90 minutes equals 1.5 hours. 300 milliliters divided by 1.5 hours equals 200 milliliters per hour. Question 10. A client weighing 110 kilograms is prescribed norepinephrine at 0.05 micrograms per kilogram per minute. The pharmacy supplies norepinephrine 8 milligrams in 250 milliliters D5W. Using dimensional analysis, what infusion rate should the nurse administer? A. 4.7 milliliters per hour. B. 5.2 milliliters per hour. C. 6.9 milliliters per hour. D. 10.3 milliliters per hour. Answer. D. 10.3 milliliters per hour. Rationale. 0,05 mcg Multiplikationszeichen 110 Kilogramm gleich 5.5 mcg Minuten. 5.5 micrograms per minute times 60 is equal to 330 mcg/HR equals 0.33 milligrams per hour. 8 milligrams divided by 250 milliliters equals 0.032 milligrams per milliliter. 0.33 milligrams per hour divided by 0.032 milligrams per milliliter equals 10.3 milliliters per hour. Question 11. A nurse is caring for a client receiving aminophylline at 0.5 milligrams per kilogram per hour. The client weighs 143 pounds. The 4-bag contains aminophylline 500 milligrams in 250 milliliters D5W. Using dimensional analysis, what infusion rate should the nurse administer? A. 14.3 milliliters per hour. B. 16.2 milliliters per hour. C. 18.5 milliliters per hour. D. 21.4 milliliters per hour. Answer. B. 16.2 milliliters per hour. Rationale. 143 Pfund Divisionszeichen 2.2 gleich 65 Kilogramm. 0.5 milligrams times 65 kilograms equals 32.5 milligrams per hour. 500 milligrams divided by 250 milliliters equals 2 milligrams per milliliter. 32.5 milligrams per hour divided by 2 milligrams per milliliter equals 16.25 milliliters per hour. Rounded equals 16.2 milliliters per hour. Question 12. A client is prescribed magnesium sulfate 2G4 to infuse over 30 minutes. The pharmacy sends magnesium sulfate 4G in 100 milliliters. How many milliliters per hour should the nurse program into the infusion pump? A. 50 milliliters per hour. B. 75 milliliters per hour. C. 100 milliliters per hour. D. 150 milliliters per hour. Answer. C. 100 milliliters per hour. Rationale. 4G in 100 milliliters means 2G is contained in 50 milliliters. 50 milliliters over 30 minutes equals 50 milliliters divided by 0.5 hours equals 100 milliliters per hour. Question 13. A provider prescribes fentanyl 1.5 micrograms per kilogram for bolus for a client weighing 72 kilograms before a bedside procedure. The vial concentration is 50 micrograms per milliliter. How many milliliters should the nurse administer? A. 1.2 milliliters. B. 1.8 milliliters. C. 2.16 milliliters. D. 3 milliliters. Answer. C. 2.16 milliliters. Rationale. 1,5 mcg Multiplikationszeichen 72 Kilogramm gleich 108 mcg. 108 micrograms divided by 50 micrograms per milliliter equals 2.16 milliliters. Question 14. A client with sepsis is prescribed vasopressin at 0.03 units/min. The pharmacy supplies 20 units in 100 milliliters NS. What infusion rate should the nurse administer? A. 6 milliliters per hour. B. 9 milliliters per hour. C. 12 milliliters per hour. D. 15 milliliters per hour. Answer. B. 9 milliliters per hour. Rationale. 0.03 units/min times 60 is equal to 1.8 units/HR. 20 units divided by 100 milliliters equals 0.2 units/ml. 1.8 units/HR divided by 0.2 units/ml equals 9 milliliters per hour. Question 15. A pediatric client weighing 44 pounds is prescribed ampicillin 200 milligrams per kilogram per day, 4 divided every 6 hours. How many milligrams should the nurse administer per dose? A. 500 milligrams. B. 750 milligrams. C. 1,000 milligrams. D. 1,250 milligrams. Answer. C. 1,000 milligrams. Rationale. 44 Pfund Divisionszeichen 2.2 gleich 20 Kilogramm. 200 milligrams times 20 kilograms equals 4,000 milligrams per day. Every 6 hours equals 4 doses/day. 4,000 milligrams divided by 4 is equal to 1,000 mg per dose. Question 16. A nurse must administer dopamine at 5 micrograms per kilogram per minute to a client weighing 95 kilograms. The 4 solution contains dopamine 800 milligrams in 500 milliliters D5W. What infusion rate should the nurse set? A. 8.9 milliliters per hour. B. 10.7 milliliters per hour. C. 17.8 milliliters per hour. D. 22.4 milliliters per hour. Answer. C. 17.8 milliliters per hour. Rationale. 5 mcg Multiplikationszeichen 95 Kilogramm gleich 475 mcg Minuten. 475 micrograms per minute times 60 is equal to 28,500 mcg / HR equals 28.5 milligrams per hour. 800 milligrams divided by 500 milliliters equals 1.6 milligrams per milliliter. 28.5 milligrams per hour divided by 1.6 milligrams per milliliter equals 17.8 milliliters per hour. Question 17. A client is prescribed lidocaine infusion at 3 milligrams per minute for ventricular dysrhythmias. The pharmacy sends lidocaine 2G in 500 milliliters D5W. What infusion rate should the nurse administer? A. 30 milliliters per hour. B. 45 milliliters per hour. C. 60 milliliters per hour. D. 75 milliliters per hour. Answer. B. 45 milliliters per hour. Rationale. 3 milligrams per minute times 60 is equal to 180 mg/HR. 2G equals 2,000 milligrams. 2,000 milligrams divided by 500 milliliters equals 4 milligrams per milliliter. 180 milligrams per hour divided by 4 milligrams per milliliter equals 45 milliliters per hour. Question 18. A nurse is preparing enoxaparin 1 milligram per kilogram subcutaneously for a client weighing 242 pounds. The medication is available as 150 milligrams per milliliter. How many milliliters should the nurse administer? A. 0.55 milliliters. B. 0.73 milliliters. C. 0.91 milliliters. D. 1.1 milliliters. Answer. B. 0.73 milliliters. Rationale. 242 Pfund Divisionszeichen 2.2 gleich 110 Kilogramm. 1 milligram times 110 kilograms equals 110 milligrams. 110 milligrams divided by 150 milligrams per milliliter equals 0.73 milliliters. Question 19. A nurse must infuse packed red blood cells totaling 350 milliliters over 2 hours using an infusion pump. What rate should the nurse program? A. 125 milliliters per hour. B. 150 milliliters per hour. C. 175 milliliters per hour. D. 200 milliliters per hour. Answer. C. 175 milliliters per hour. Rationale. 350 milliliters divided by 2 hours equals 175 milliliters per hour. Question 20. A provider prescribes epinephrine infusion at 0.08 micrograms per kilogram per minute for a client weighing 75 kilograms. The 4 solution contains epinephrine 4 milligrams in 250 milliliters D5W. Using dimensional analysis, what infusion rate should the nurse administer? A. 18 milliliters per hour. B. 22.5 milliliters per hour. C. 30 milliliters per hour. D. 36 milliliters per hour. Answer. B. 22 milliliters per hour. Rationale. 0,08 mcg Multiplikationszeichen 75 Kilogramm gleich 6 mcg Minuten. 6 micrograms per minute times 60 is equal to 360 mcg / HR equals 0.36 milligrams per hour. For milligrams divided by 250 milliliters equals 0.016 milligrams per milliliter. 0.36 milligrams per hour divided by 0.016 milligrams per milliliter equals 22.5 milliliters per hour. Question 21. A client with acute pulmonary edema is prescribed furosemide infusion at 10 milligrams per hour. The pharmacy supplies furosemide 250 milligrams in 100 milliliters NS. Using dimensional analysis, what infusion rate should the nurse administer? A. 2 milliliters per hour. B. 4 milliliters per hour. C. 6 milliliters per hour. D. 8 milliliters per hour. Answer. B. 4 milliliters per hour. Rationale. 250 milligrams divided by 100 milliliters equals 2.5 milligrams per milliliter. 10 milligrams per hour divided by 2.5 milligrams per milliliter equals 4 milliliters per hour. Question 22. A pediatric client weighing 26.4 pounds is prescribed gentamicin 7.5 milligrams per kilogram per day, 4 divided every 8 hours. How many milligrams should the nurse administer per dose? A. 22.5 milligrams. B. 27 milligrams. C. 30 milligrams. D. 35 milligrams. Answer. C. 30 milligrams. Rationale. 26,4 Pfund Divisionszeichen 2.2 gleich 12 Kilogramm. 7.5 milligrams times 12 kilograms equals 90 milligrams per day. Every 8 hours equals 3 doses/day. 90 milligrams divided by 3 is equal to 30 mg per dose. Question 23. A nurse is administering dobutamine at 7 micrograms per kilogram per minute to a client weighing 80 kilograms. The pharmacy sends dobutamine 500 milligrams in 250 milliliters D5W. What infusion rate should the nurse set? A. 8.4 milliliters per hour. B. 12.6 milliliters per hour. C. 16.8 milliliters per hour. D. 20.4 milliliters per hour. Answer. C. 16.8 milliliters per hour. Rationale. 7 mcg Multiplikationszeichen 80 Kilogramm gleich 560 mcg in Minuten. 560 micrograms per minute times 60 is equal to 33,600 mcg/hr equals 33.6 milligrams per hour. 500 milligrams divided by 250 milliliters equals 2 milligrams per milliliter. 33.6 milligrams per hour divided by 2 milligrams per milliliter equals 16.8 milliliters per hour. Question 24. A provider prescribes levetiracetam 1,500 milligrams IV/PB over 15 minutes. The medication is diluted in 100 milliliters NS. What infusion rate should the nurse program into the infusion pump? A. 200 milliliters per hour. B. 300 milliliters per hour. C. 400 milliliters per hour. D. 600 milliliters per hour. Answer. C. 400 milliliters per hour. Rationale. 15 minutes equals 0.25 hours. 100 milliliters divided by 0.25 hours equals 400 milliliters per hour. Question 25. A client weighing 68 kilograms is prescribed ketamine 0.3 milligrams per kilogram for push for severe procedural pain. The vial contains ketamine 50 milligrams per milliliter. How many milliliters should the nurse administer? A. 0.2 milliliters. B. 0.41 milliliters. C. 0.58 milliliters. D. 0.82 milliliters. Answer. B. 0.41 milliliters. Rationale. 0.3 milligrams times 68 kilograms equals 20.4 milligrams. 20.4 milligrams divided by 50 milligrams per milliliter equals 0.408 milliliters. Rounded equals 0.41 milliliters. Question 26. A nurse must administer amiodarone at 1 milligram per minute for 6 hours. The 4-bag contains 360 milligrams in 200 milliliters D5W. What infusion rate should the nurse administer? A. 20 milliliters per hour. B. 25 milliliters per hour. C. 33.3 milliliters per hour. D. 40 milliliters per hour. Answer. C. 33.3 milliliters per hour. Rationale. 1 milligram per minute times 60 is equal to 60 mg/hr. 360 milligrams divided by 200 milliliters equals 1.8 milligrams per milliliter. 60 milligrams per hour divided by 1.8 milligrams per milliliter equals 33.3 milliliters per hour. Question 27. A client weighing 132 pounds is prescribed hydromorphone 0.015 milligrams per kilogram for every 3 hours PRN severe pain. The vial concentration is 2 milligrams per milliliter. How many milliliters should the nurse administer? A. 0.3 milliliters. B. 0.45 milliliters. C. 0.6 milliliters. D. 0.75 milliliters. Answer. B. 0.45 milliliters. Rationale. 132 Pfund Divisionszeichen 2.2 gleich 60 Kilogramm. 0.015 milligrams times 60 kilograms equals 0.9 milligrams. 0.9 milligrams divided by 2 milligrams per milliliter equals 0.45 milliliters. Question 28. A provider prescribes propofol at 35 micrograms per kilogram per minute for a mechanically ventilated client weighing 70 kilograms. The 4-bottle contains propofol 1,000 milligrams in 100 milliliters. What infusion rate should the nurse administer? A. 8.4 milliliters per hour. B. 10.5 milliliters per hour. C. 14.7 milliliters per hour. D. 18.2 milliliters per hour. Answer. C. 14.7 milliliters per hour. Rationale. 35 mcg Multiplikationszeichen 70 Kilogramm gleich 2,450 mcg Minuten. 2,450 micrograms per minute times 60 is equal to 147,000 mcg/hr equals 147 milligrams per hour. 1,000 milligrams divided by 100 milliliters equals 10 milligrams per milliliter. 147 milligrams per hour divided by 10 milligrams per milliliter equals 14.7 milliliters per hour. Question 29. A nurse is preparing acetaminophen 15 milligrams per kilogram PO for a febrile child weighing 18 kilograms. The liquid concentration is 160 milligrams per 5 milliliters. How many milliliters should the nurse administer? A. 6.4 milliliters. B. 7.5 milliliters. C. 8.4 milliliters. D. 9.2 milliliters. Answer. C. 8.4 milliliters. Rationale. 15 milligrams times 18 kilograms equals 270 milligrams. 160 milligrams. 5 milliliters equals 270 milligrams x. Open parenthesis, 270 times 5 close parenthesis divided by 160 is equal to 8.4 ml. Question 30. A client with septic shock is prescribed phenylephrine at 1.2 micrograms per kilogram per minute. The client weighs 85 kilograms. The 4 solution contains phenylephrine 40 milligrams in 250 milliliters D5W. What infusion rate should the nurse administer? A. 11.5 milliliters per hour. B. 15.3 milliliters per hour. C. 18.4 milliliters per hour. D. 38.25 milliliters per hour. Answer. D. 38.25 milliliters per hour. Rationale. 1,2 mcg Multiplikationszeichen 85 Kilogramm gleich 102 mcg Minuten. 102 micrograms per minute times 60 is equal to 6,120 mcg/hr equals 6.12 milligrams per hour. 40 milligrams divided by 250 milliliters equals 0.16 milligrams per milliliter. 6.12 milligrams per hour divided by 0.16 milligrams per milliliter equals 38.25 milliliters per hour. Question 31. A nurse is administering nitroprusside at 2 micrograms per kilogram per minute to a client weighing 77 kilograms. The pharmacy supplies nitroprusside 50 milligrams in 250 milliliters D5W. What infusion rate should the nurse program into the pump? A. 18.5 milliliters per hour. B. 46.2 milliliters per hour. C. 27.7 milliliters per hour. D. 32.4 milliliters per hour. Answer. B. 46.2 milliliters per hour. Rationale. 2 mcg Multiplikationszeichen 77 Kilogramm gleich 154 mcg in Minuten. 154 micrograms per minute times 60 is equal to 9,240 mcg / HR equals 9.24 milligrams per hour. 50 milligrams divided by 250 milliliters equals 0.2 milligrams per milliliter. 9.24 milligrams per hour divided by 0.2 milligrams per milliliter equals 46.2 milliliters per hour. Question 32. A pediatric client weighing 55 pounds is prescribed methylprednisolone 2 milligrams per kilogram per day, 4 divided every 12 hours. How many milligrams should the nurse administer per dose? A. 25 milligrams. B. 40 milligrams. C. 50 milligrams. D. 75 milligrams. Answer. A. 25 milligrams. Rationale. 55 Ton Divisionszeichen 2.2 gleich 25 Kilogramm. 2 milligrams times 25 kilograms equals 50 milligrams per day. Divided every 12 hours equals 2 doses / day. 50 milligrams divided by 2 is equal to 25 mg per dose. Question 33. A client weighing 64 kilograms is prescribed lorazepam 0.04 milligrams per kilogram for status epilepticus. The vial concentration is 2 milligrams per milliliter. How many milliliters should the nurse administer? A. 0.64 milliliters. B. 1.28 milliliters. C. 1.92 milliliters. D. 2.56 milliliters. Answer. B. 1.28 milliliters. Rationale. 0.04 milligrams times 64 kilograms equals 2.56 milligrams. 2.56 milligrams divided by 2 milligrams per milliliter equals 1.28 milliliters. Question 34. A provider prescribes regular insulin at 6 units / HR via infusion pump. The 4 solution contains 100 units insulin in 250 milliliters NS. What infusion rate should the nurse administer? A. 10 milliliters per hour. B. 12 milliliters per hour. C. 15 milliliters per hour. D. 18 milliliters per hour. Answer. C. 15 milliliters per hour. Rationale. 100 units divided by 250 milliliters equals 0.4 units / ml. 6 units / HR divided by 0.4 units / ml equals 15 milliliters per hour. Question 35. A nurse must administer cefepime 2g IV PB over 20 minutes. The medication is diluted in 100 milliliters NS. What infusion rate should the nurse set? A. 200 milliliters per hour. B. 250 milliliters per hour. C. 300 milliliters per hour. D. 400 milliliters per hour. Answer. C. 300 milliliters per hour. Rationale. 20 minutes equals 0.333 hours. 100 milliliters divided by 0.333 hours is almost equal to 300 milliliters per hour. Question 36. A client weighing 101 kilograms is prescribed Alteplase 0.9 milligrams per kilogram for acute ischemic stroke. The maximum dose is 90 milligrams. How many milligrams should the nurse prepare? A. 75 milligrams. B. 81 milligrams. C. 90 milligrams. D. 99 milligrams. Answer. C. 90 milligrams. Rationale. 0.9 milligrams times 101 kilograms equals 90.9 milligrams. Because the maximum allowed dose is 90 milligrams, the nurse administers 90 milligrams. Question 37. A nurse is administering milrinone at 0.5 micrograms per kilogram per minute to a client weighing 88 kilograms. The 4 solution contains 20 milligrams in 100 milliliters D5W. What infusion rate should the nurse administer? A. 6.6 milliliters per hour. B. 7.9 milliliters per hour. C. 9.2 milliliters per hour. D. 13.2 milliliters per hour. Answer. D. 13.2 milliliters per hour. Rationale. 0,5 mcg Multiplikationszeichen 88 Kilogramm gleich 44 mcg Minuten. 44 micrograms per minute times 60 is equal to 2,640 mcg / HR equals 2.64 milligrams per hour. 20 milligrams divided by 100 milliliters equals 0.2 milligrams per milliliter. 2.64 milligrams per hour divided by 0.2 milligrams per milliliter equals 13.2 milliliters per hour. Question 38. A pediatric client weighing 14 kilograms is prescribed ibuprofen 10 milligrams per kilogram PO every 6 hours PRN fever. The suspension contains 100 milligrams per 5 milliliters. How many milliliters should the nurse administer? A. 5 milliliters. B. 6 milliliters. C. 7 milliliters. D. 8 milliliters. Answer. C. 7 milliliters. Rationale. 10 milligrams times 14 kilograms equals 140 milligrams. 100 milligrams. 5 milliliters equals 140 milligrams x. Open parenthesis 140 times 5 close parenthesis divided by 100 is equal to 7 ml. Question 39. A provider prescribes dexmedetomidine at 0.6 micrograms per kilogram per hour for a client weighing 70 kilograms. The pharmacy supplies dexmedetomidine 200 micrograms in 50 milliliters NS. What infusion rate should the nurse administer? A. 8.5 milliliters per hour. B. 10.5 milliliters per hour. C. 12.8 milliliters per hour. D. 15.2 milliliters per hour. Answer. B. 10.5 milliliters per hour. Rationale. 0,6 mcg Multiplikationszeichen 70 Kilogramm gleich 42 mcg higher. 200 micrograms divided by 50 milliliters equals 4 micrograms per milliliter. 42 micrograms per hour divided by 4 micrograms per milliliter equals 10.5 milliliters per hour. Question 40. A client weighing 176 pounds is prescribed pantoprazole infusion at 8 milligrams per hour after an upper GI bleed. The 4-bag contains pantoprazole 80 milligrams in 100 milliliters NS. What infusion rate should the nurse administer? A. 8 milliliters per hour. B. 10 milliliters per hour. C. 12 milliliters per hour. D. 15 milliliters per hour. Answer. B. 10 milliliters per hour. Rationale. 80 milligrams divided by 100 milliliters equals 0.8 milligrams per milliliter. 8 milligrams per hour divided by 0.8 milligrams per milliliter equals 10 milliliters per hour. Question 41. A nurse is caring for a client receiving epoprostenol at 4 ing/kg/min for pulmonary arterial hypertension. The client weighs 75 kilograms. The 4 solution contains epoprostenol 1.5 milligrams in 100 milliliters. What infusion rate should the nurse administer? A. 0.8 milliliters per hour. B. 1.2 milliliters per hour. C. 1.8 milliliters per hour. D. 2.4 milliliters per hour. Answer. B. 1.2 milliliters per hour. Rationale. 475 kg 300 một min. 300 một min 60 mg. HT 18 kg 1 HT 0.018 mg. HT. 1.5 milligrams divided by 100 milliliters equals 0.015 milligrams per milliliter. 0.018 milligrams per hour divided by 0.015 milligrams per milliliter equals 1.2 milliliters per hour. Question 42. A pediatric client weighing 39.6 pounds is prescribed acyclovir 30 milligrams per kilogram per day, 4 divided every 8 hours. How many milligrams should the nurse administer per dose? A. 150 milligrams. B. 180 milligrams. C. 210 milligrams. D. 240 milligrams. Answer. B. 180 milligrams. Rationale. 39,6 Ton Divisionszeichen 2.2 gleich 18 Kilogramm. 30 milligrams times 18 kilograms equals 540 milligrams per day. Every 8 hours equals 3 doses / day. 540 milligrams divided by 3 is equal to 180 mg per dose. Question 43. A provider prescribes ketorolac 0.5 milligrams per kilogram for every 6 hours PRN pain for a client weighing 154 pounds. The medication is available as 30 milligrams per milliliter. How many milliliters should the nurse administer? A. 0.8 milliliters. B. 1 milliliter. C. 1.2 milliliters. D. 1.5 milliliters. Answer. C. 1.2 milliliters. Rationale. 154 Ton Divisionszeichen 2.2 gleich 70 Kilogramm. 0.5 milligrams times 70 kilograms equals 35 milligrams. 35 milligrams divided by 30 milligrams per milliliter equals 1.17 milliliters. Rounded equals 1.2 milliliters. Question 44. A client with cardiogenic shock is prescribed dopamine at 12 micrograms per kilogram per minute. The client weighs 90 kilograms. The 4 solution contains dopamine 800 milligrams in 250 milliliters D5W. What infusion rate should the nurse administer? A. 12.2 milliliters per hour. B. 16.2 milliliters per hour. C. 20.3 milliliters per hour. D. 24.3 milliliters per hour. Answer. C. 20.3 milliliters per hour. Rationale. 12 mcg Multiplikationszeichen 90 Kilogramm gleich 1,080 mcg Minuten. 1,080 micrograms per minute times 60 is equal to 64,800 mcg / HR equals 64.8 milligrams per hour. 800 milligrams divided by 250 milliliters equals 3.2 milligrams per milliliter. 64.8 milligrams per hour divided by 3.2 milligrams per milliliter equals 20.25 milliliters per hour. Rounded equals 20.3 milliliters per hour. Question 45. A nurse must infuse 1,000 milliliters lactated Ringer's solution over 7 hours using an infusion pump. What infusion rate should the nurse program? A. 125 milliliters per hour. B. 143 milliliters per hour. C. 150 milliliters per hour. D. 175 milliliters per hour. Answer. B. 143 milliliters per hour. Rationale. 1,000 milliliters divided by 7 hours equals 142.8 milliliters per hour. Rounded equals 143 milliliters per hour. Question 46. A provider prescribes norepinephrine at 0.2 micrograms per kilogram per minute for a client weighing 82 kilograms. The 4 solution contains norepinephrine 16 milligrams in 250 milliliters D5W. What infusion rate should the nurse administer? A. 9.2 milliliters per hour. B. 12.3 milliliters per hour. C. 15.4 milliliters per hour. D. 18.6 milliliters per hour. Answer. C. 15.4 milliliters per hour. Rationale. 0,2 mcg Multiplikationszeichen 82 Kilogramm gleich 16.4 mcg Minuten. 16.4 micrograms per minute times 60 is equal to 984 mg/hr equals 0.984 milligrams per hour. 16 milligrams divided by 250 milliliters equals 0.064 milligrams per milliliter. 0.984 milligrams per hour divided by 0.064 milligrams per milliliter equals 15.375 milliliters per hour. Rounded equals 15.4 milliliters per hour. Question 47. A pediatric client weighing 22 kilograms is prescribed clindamycin 40 milligrams per kilogram per day, 4 divided every 6 hours. How many milligrams should the nurse administer per dose? A. 180 milligrams. B. 220 milligrams. C. 260 milligrams. D. 320 milligrams. Answer. B. 220 milligrams. Rationale. 40 milligrams times 22 kilograms equals 880 milligrams per day. Every 6 hours equals 4 doses/day. 880 milligrams divided by 4 is equal to 220 mg per dose. Question 48. A client is prescribed dexamethasone 0.15 milligrams per kilogram for airway edema. The client weighs 48 kilograms. The medication concentration is 4 milligrams per milliliter. How many milliliters should the nurse administer? A. 1.2 milliliters. B. 1.5 milliliters. C. 1.8 milliliters. D. 2.4 milliliters. Answer. C. 1.8 milliliters. Rationale. 0.15 milligrams times 48 kilograms equals 7.2 milligrams. 7.2 milligrams divided by 4 milligrams per milliliter equals 1.8 milliliters. Question 49. A nurse is administering nicardipine at 7.5 milligrams per hour for hypertensive emergency. The 4 solution contains nicardipine 25 milligrams in 250 milliliters NS. What infusion rate should the nurse administer? A. 55 milliliters per hour. B. 65 milliliters per hour. C. 75 milliliters per hour. D. 85 milliliters per hour. Answer. C. 75 milliliters per hour. Rationale. 25 milligrams divided by 250 milliliters equals 0.1 milligrams per milliliter. 7.5 milligrams per hour divided by 0.1 milligrams per milliliter equals 75 milliliters per hour. Question 50. A critically ill client weighing 210 pounds is prescribed fentanyl infusion at 2 micrograms per kilogram per hour. The 4 bag contains fentanyl 2,500 micrograms in 250 milliliters NS. Using dimensional analysis, what infusion rate should the nurse administer? A. 15.2 milliliters per hour. B. 19 milliliters per hour. C. 22.8 milliliters per hour. D. 26.4 milliliters per hour. Answer. B. 19 milliliters per hour. Rationale. 210 von Divisionszeichen 2.2 gleich 95,5 Kilogramm. 2 mcg Multiplikationszeichen 95,5 Kilogramm gleich 191 mcg hr. 2,500 micrograms divided by 250 milliliters equals 10 micrograms per milliliter. 191 micrograms per hour divided by 10 micrograms per milliliter equals 19.1 milliliters per hour. Rounded equals 19 milliliters per hour. If you made it through all 50 questions, you just train like a real Nclex test taker under pressure. Medication math is not about memorizing random formulas. It's about staying systematic, canceling units correctly, and avoiding dangerous clinical errors. The more dimensional analysis problems you practice, the faster your brain recognizes patterns. Kage conversions. MIC G2MG calculations. Infusion pump settings. Pediatric dosing. Titration drips. Critical care medication math. On the Nclex, one decimal error can completely change the answer. That's why strong nurses always convert units first. Line up dimensions carefully. Recheck pump calculations. Watch for maximum dose limits. Verify whether the final answer should be in ml/hr, mg, units, or MIC-G. Keep practicing until dimensional analysis feels automatic under time pressure. For more high-level Nclex reviews, critical care rapid-fire questions, SATA and NGN case studies, ICU drips and titration math, emergency pharmacology, med-suri prioritisation, pediatric dosage calculations. Stay locked in with MCQs Master 101 for pro-level Nclex preparation. Study smart. Calculate safely. Pass confidently.